Angina is basically, it's a medical term for pain. So angina means pain, literally means pain due to lack of oxygen. When it happens in the heart, we call it cardiac angina. And why it happens is, as you know, our heart pumps oxygenated blood, red blood, to the body. And it is a pump. It is like my fist. If your fist, your heart will be the size of your fist. So it is this big. So this is a bundle of muscle. And this muscle needs energy. And that energy is supplied by arteries, which supply the heart. So when the heart arteries get small or get blocked, then it produces angina. So angina is basically pain in the left side of the chest, radiating to the left jaw or to the left hand. So that is a typical angina, more during the cold weather, more during exertion. Patient says, when I'm walking fast, then I have pain in the chest. When I slow down, it goes away. So that is classical angina. If a patient gives that symptom, we know he's got a heart disease, and we are very, very aggressive in starting the treatment. Sometimes there may not be angina, there may be sweating, especially in a diabetic. In a diabetic, sometimes pain is not there. So there may be severe sweating. There may be uneasiness. Patient says, "Oh, I'm just feeling something wrong with me. I don't know what. I don't have pain. I don't have sweating, but there is something happening." So we should not ignore it. Ladies are also increasing in number in heart disease. So please don't ignore. Don't say it is just psychological. Earlier on, we used to say, "Oh, kuch nahi, nothing is there." So if somebody, anybody, even a lady, says, "I'm feeling abnormal," then please get an ECG at least. And then, of course, if the ECG is positive, then we do some other tests. There is something called unstable angina, which means patient is sitting and he's getting pain. I told you earlier that it happens typically when the patient is walking fast. So if he is just sitting and it is getting there, it's called unstable, which means it can deteriorate to a heart attack. Similarly, there's something called nocturnal angina. Patient has had dinner, he's had a drink, and is about to go to sleep, and he gets pain that is called nocturnal. Nocturnal means night. So these are some of the common types of angina. See, angina is the warning. So God has actually made a very good machine, that is us, with feedback mechanisms. For example, if there is a fire and I put my finger in it, I'll get pain. So I'll remove my finger. If I don't get pain, then my finger will burn away and I won't even know it. So angina is God is warning you, son, you are having some problem in the heart, behave yourself and get a checkup done. While a heart attack means that you have not behaved yourself and the artery supplying the blood blocks and the muscle dies. That is called a heart attack. And a heart attack is an actual emergency. We say time is muscle. Every minute we lose in getting to the hospital is causing more grams of muscle to be lost. And the sooner we get to hospital, the sooner the treatment, which is either a blood thinner or a spring or a bypass, can be initiated. See, the basic ones are first, most important is examination by a competent physician, doctor. Next is ECG. Next is a blood test like a TROP-T or a TROP-I, which is available in most places all over India. Next is an echo, which is just a scanning of the heart without any injection. After that is a treadmill test or a stress test. We make you walk on a machine like in a gym. It's actually a gym machine, but we connect ECG. So that will give us an idea whether your heart is having trouble. Then there are some very advanced tests we do in not very clear cases where we're not sure. So one of them is a thallium or a perfusion scan where we see how much blood is entering the heart. And when we want to see the anatomy, then we have to do an angiogram. Angiogram can be of two types, a CT angiogram, for which you don't need admission. You just go, whole process takes about half an hour. The actual scan takes 5 minutes, or actually it within one breath, within 10 beats of the heart, the scan is over. But the procedure coming to the center may take about an hour. And the last one is a conventional coronary angiogram, where I admit you for at least half a day. We put a catheter inside your artery and see where the block is. So, with these are the complete set of diagnostic things that we have. See, before treatment is the prevention, which I told earlier. I'll summarize in lifestyle changes, control blood pressure, control sugar, control your weight, exercise, and reduce stress. Treatment first is either a blood thinner because blood is clotting inside the coronary. Second is sometimes it is better to straight away spring or a stent the block. This is possible if it is a single vessel and the patient is not a diabetic. If the patient is a diabetic and has more than one artery blocked, then I would do a bypass surgery. Bypass surgery is very predictable, very safe in the majority of cases, and gives you good results for the next 30, 40, 50 years. And it is safe now, I would like to say, because of a new technique, which incidentally was initiated by my team in Punjab in early 2000s or the late 1990s. It's called beating heart surgery. And we published the first results of beating heart surgery in multi-vessel disease with angiograms. And now, over the next 25 years, a lot of modifications. Almost all surgeons are very well trained in doing beating heart surgery. The results are excellent. Mortality is very, very, very low. If earlier it was 2%, now it is 0.2%. So that is the amount of change which has happened. And we can predict that this patient will do well after surgery, and after the next 30 years, he'll do all right. So treatment is available. Of course, it is not a very happy thing to do a surgery on a patient, I know. But if you have a heart disease, then don't worry. Get it treated. And don't get into any rumors that, people die from heart surgery. We have all over India, all over the world, the incidence of death is 0.2% in elective cases. That is patients who come in time. So don't go into the high risk group where the risk of death may be more. So we should get it treated at the earliest.